Hello, Santa.
Hi,
How
Doctor.
are you?
Good.
Great to see you again.
Thank you.
Well, let's review your findings from your annual physical, okay?
Okay.
I got a note from Mrs. Claus,
Uh-oh.
and she ratted you out a bit.
Oh, no.
She says that you haven't been getting enough exercise. You put on a little bit more weight.
Yeah, that's true.
And she's a little bit worried about your smoking.
Uh-oh.
So one thing I am going to do, Santa, is just recheck your blood pressure. The nurse got a little bit of a high number, so let me just check it myself, okay? See how we're doing. And you've been feeling okay?
Been feeling good.
Good. Okay, Santa, yeah, the blood pressure is up.
Uh-oh.
So, let's talk about what we need to do here. First of all, I'd like you to get your flu shot today.
Okay.
You know, this is the time when we have flu epidemics and you have a lot of kids coming to see you and sitting on your lap, and even if you don't get sick, we don't want you giving it to one of those sweet little kids.
Okay.
You also passed 50 years old a long time ago. So we need to be doing a colonoscopy.
Oh, no.
I know. And Mrs. Claus said you weren't going to like this.
No.
But let me tell you, I've had a lot of patients with colon cancer and that could have been caught early and prevented, and they would gladly go through a colonoscopy in order not to have that. And so we don't want you getting something. So I'd like to schedule your colonoscopy for after Christmas, once you can kind of relax again, and we'll check that out, okay?
Okay.
All right, so now let's talk about what can we do to make you healthier.
Okay.
There's a few simple things we can do. And first of all, it's just about making better food choices. So, you know, a lot of the kids are leaving you some things out when you visit their homes.
Yes.
And, you know, it's okay to have a cookie once in a while. The problem is you can't have a cookie at every kid's house.
Oh.
Okay? That's a lot of cookies.
That's a lot of cookies.
So, you know, so we got to cut back on that. The next thing is, you know, I think you ought to tweet to all the kids on your Twitter account that, you know, Santa would prefer to have some reduced fat milk.
Okay.
Because if the kids are leaving you eggnog, this is twice the calories and twice the fat.
Oh my.
So it'd be much better for you to drink the reduced fat milk. Okay?
Okay.
I know you have Rudolph and all the reindeers to take you every place you need to go.
Yes.
But for places near the North Pole where you need to go around, it'd be good if you would walk. Just get out and do some walking.
Okay.
10,000 steps a day.
10,000?
That's what we're going to shoot for. And we'll give you a pedometer, and so you can measure it, but get out there and walk and set a good example for the elves. We've got great people that work with our Healthy You program here at St. Luke's, and they can talk to you about how to make some easy changes to your lifestyle. We have some great classes, and you can watch, even from the North Pole, you can watch some of our Healthy You videos and learn about things that you can do.
Okay.
And the next thing, the smoking.
Uh-oh.
I know you like your pipe, Santa, but I want to make sure that you understand that smoking of any type is associated with certain cancers. So one of the things we'd like to do is to have our Healthy You folks work with you. Maybe we'll start you on a nicotine nasal spray, and so that you don't go through the withdrawal, but we get you to smoke less, and then we can transition you off of that later.
Okay.
Okay, and Mrs. Claus will be really happy. And I know you don't want Mrs. Claus on your case.
No, I don't want that.
As you know, I've got 3 grandkids on the way, and they're going to be excited about Santa Claus coming to see them, so let's keep you real healthy.
Very good, thank you.
All right, well, it's great to see you, and I'll see you next year.
Absolutely.
All right.
Once a year.
Take care, Santa.
Merry Christmas.
Merry Christmas to you. Bye-bye.